Dear EAU members, dear colleagues, dear friends, I'm Vincent Misrahi, urologist in Toulouse at Clinique Pasteur, France, and I'm glad to present with great faculty this new edition of the webinar dedicated on minimally invasive treatment for male LUTS. In this webinar, you will find the most updated information about the new technologies to treat BPO. And in these new technologies, you have a large armamentarium of techniques, including Aqua Ablation and Resume. These techniques are using water, this kind of new, and it's not new energy sources, but it's used to treat BPO and to relieve the prostatic obstruction. And we will see what is this technique and what is the evidence, the results, and of course the limitations. Immediately after that, Dr. Neil Barber will present you in the same way what is the Urolift technique. It will summarize finally the sum of all the information and what is the evidence about Urolift. Immediately after that, Dr. Neil Barber will talk to you about what is the place of minimally invasive techniques against the gold standard. As you know, the gold standard are still TURP in the guidelines and open prostatectomy, but things are evolving for the best, not for the worst, for the best for the patient. As urologists, we need to choose the right treatment for the right patient. Nowadays, patients have a lot of expectations, including having a safe procedure, including to preserve their sexual health and ejaculation function. So there is a large armamentarium available in our daily practice to do that, beside gold standard we mentioned. And what is the place of these new mini-invasive technologies will be delivered to you in order to produce tailor-made treatment. I don't want to spoil you my presentation, but if you wish personal insights about what could be the best option for patients, I guess that there is no better technologies than another. All these techniques are really promising, but we have to keep in mind that human factors and the surgeon skill is really important at the time of doing surgery. We have many things to take into account as urologists when we choose such technologies. First, finally, the carbon footprint, because we used disposable devices. So you threw it away, the technology, when after the patient use. First, so we need to have a deep reflection on that. And second, we should evolve towards semi-autonomous procedure. It means that we should get rid of as much as possible from surgeon expertise, and as well we will see the clear indication and what is the evidence so far published in the literature